Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing about the anatomy of submandibular gland and the sublingual gland. In my previous video, I already discussed about the anatomy of the parotid gland. You can check it out separately. Today we'll be talking about the submandibular and the sublingual gland. You can also now purchase my notes. I have added links in the description. Okay, so first let's get started with the submandibular gland. So, submandibular gland is the second largest of the three major salivary glands right after parotid. Now, if you look at the shape of it, it is a little walnut shaped. If you look at the image over here, this here is the submandibular gland. This is walnut shaped and the weight is about 7 to 14 grams. And this is a mixed type of salivary gland which consists of both serous as well as mucus acini. We saw earlier that how parotid gland was typically a serous type of acini only, whereas submandibular is mixed, containing both. Now, coming to its location, if we come to the location, we can see that the submandibular gland lies in the submandibular triangle. If you see in the right side image over here, this is the submandibular triangle. This triangle is bounded by the anterior belly of digastric, the posterior belly of digastric, and the inferior margin of the mandible. So this is the location of the submandibular gland. Next, let's talk about what are the different parts of submandibular gland. Now, submandibular gland has two parts, a superficial part and a deep part. And both these parts, they are continuous around the posterior border of the mylohyoid muscle. Now, let's look at the image on the right side. This here is the mylohyoid muscle. You can see how this is the superficial part of the gland and this is the deeper part of the gland. You can see how the superficial part is continuous with the deep part of the gland along the posterior border of the mylohyoid muscle. Now we'll discuss each of these parts. What are the different parts? What are the different surfaces in each of these parts, and what are the relations? Which is a very, very important question. So, first, let's start with the superficial part. Now, superficial part has two ends and three surfaces. There's an anterior and a posterior end, and there's an inferior, lateral, and a medial surface. Starting off with the anterior end, so the anterior end, it extends up to the anterior belly of digastric. The posterior end, it extends posteriorly up to the stylomandibular ligament, and this ligament separates it from the parotid gland. That is an important part to remember here. And this end has a groove which lodges the ascending limb of the cervical loop of facial artery. Now, as we're talking about the superficial part, it is important to know that only the superficial part of the submandibular gland has a capsule around it, and that too, it's not around all of its surface. Only two of the surfaces are surrounded by the capsule. So, the superficial part is partly enclosed. And how is this capsule formed? Where is the origin of the capsule? It is formed by the investing layer of the deep cervical fascia. So now let's look at the image on the right side. This is the investing layer of the deep cervical fascia. This is the greater cornu of the hyoid bone. Now at the greater cornu of the hyoid bone, the investing layer, it divides into two lamina. And it encloses the superficial part. So there is a superficial layer and a deep layer. Now first looking at the superficial layer, this is the superficial layer. This superficial layer covers the inferior surface of the gland and then it gets attached to the base of the mandible. Whereas the deep lamina, which is this one over here, the deep layer, it covers the medial surface of the gland and then it is connected to the mylohyoid line of the mandible. So this is the attachment of the capsule of the superficial part of submandibular gland. Next, let's look into the different surfaces. So we talked about there are three surfaces. So the first one is the inferior surface, which is also known as the superficial surface. Now let's look at the relations of inferior or the superficial surface from superficial to deep. So we'll start from the most superficial structure. Let's look at the first image over here. These are all the relations. So we have, first of all, we have skin. Then we have the superficial cervical fascia, which contains the platysma as well as the cervical branch of the facial nerve. Next, we have the deep fascia. Then we have our facial vein. Sorry, that facial vein lies underneath the superficial fascia. Then we have the deep fascia, and then last of all, we have the submandibular lymph nodes. So these are the different relations of the superficial surface or the inferior surface of the superficial part of the submandibular gland. Next surface is the lateral surface. Now, the lateral surface is related to three structures. First of all is the submandibular fossa, which is present on the inner aspect of the body of mandible. Second is the medial pterygoid muscle near its insertion. Third is facial artery. Now, we need to know a little bit more about the artery over here. You can see in the image, this is the submandibular gland and this is the facial artery. So there's a particular relation that is there over here. So the facial artery over here, it loops downwards and forwards between the bone and the gland, and after that it winds around the lower border of the body of the mandible at the antero-inferior angle of the mandible, and then it reaches the face. So you can see that this loop happens right over here. So this is an important anatomical feature that you need to remember, the relation of facial artery with the lateral surface of the gland. So these were the three structures in relation to lateral surface. Coming to our last surface, which is the medial surface. Now this is a little bit more complicated because there's a lot of relations to remember here. The medial surface is actually very extensive, so we split it into three parts: anterior, middle, and posterior. Now first we'll talk about the anterior part. Now let's look at the image over here. This here is the anterior part. So the structures which is related over here are the mylohyoid muscle, the submental branch of facial artery, and the mylohyoid nerve and vessels. So these are the structures which is related to the anterior part of the medial surface. Next we come to the middle part of the medial surface. And this middle part is related, if you look at again at the image here, these are the middle part relations. So in the middle part, the structures which are related are, first of all, is the hyoglossus muscle. Then there's also the styloglossus muscle. We have the lingual nerve and the hypoglossal nerve. And last of all, we have the submandibular ganglion. These are the relations of the middle part. Coming to our last part, which is the posterior part. Now, the posterior part has a lot of relations. Here, we are going to look at the posterior part of the medial surface. So, we have our styloglossus muscle, we have our stylopharyngeus muscle, we have a glossopharyngeal nerve, posterior belly of digastric, middle, the constrictor of the pharynx forming the lateral wall of the pharynx, the hypoglossal nerve, and first part of lingual artery, and even the lingual nerve. So these are all the relations of the different surfaces of the submandibular gland. Next, let's talk about the deep part of the gland. Now, the deep part lies deep to the mylohyoid muscle. So it extends forward in the interval lying between the mylohyoid and the hyoglossus muscle up to the posterior end of the sublingual gland. We had seen in the image before. Here, you can look over here. This is the deep part over here, and this is the sublingual gland. That's where it extends. It lies in between the mylohyoid muscle over here and between the hyoglossus muscle, and it extends towards the sublingual gland. Now, let's look at the relations of the deep part. Now, this deep part is related laterally to the mylohyoid muscle, as I just showed, medially to the hyoglossus muscle, again, I showed in the previous one. Superiorly, it is related to the lingual nerve and the submandibular ganglion, which is hanging from the lingual nerve. And inferiorly, it is related to the hypoglossal nerve accompanied by a pair of veins. So that's all about the different parts of submandibular gland. Next, we are going to talk about the submandibular duct. Now, submandibular duct has another name and it is known as Wharton's duct. So these are all names that you have to remember. Parotid duct is also known as Stenson's duct. So submandibular duct is 5 centimeter long. Now we look at the course of the submandibular duct. So it begins from middle of the deep surface of the superficial part of the gland, So it is important to remember that it develops from the superficial part of the gland. Then it appears at the anterior end of the deep part. Now let's look at the image over here. This is the superficial part and this is the deep part. So it appears at the end of the anterior end of the deep part. Here it runs forward on the hyoglossus between the lingual nerve and the hypoglossal nerve. Once it has reached the anterior border, if you see in the image, this is the anterior border of the hyoglossus. Over here, it is crossed by the lingual nerve. You can see how the lingual nerve is looping around the submandibular duct over here. Then, as it is crossed by the lingual nerve, after that, it continues running forward between the sublingual gland and the genioglossus, and then it opens into the floor of the mouth on a sublingual papilla. And where does this lie? The sublingual papilla lies on each side of the frenulum linguae. So this is the course of the submandibular duct. Important feature to remember here is the relation of the duct with the lingual nerve. So if you see, let's look at the image over here. So if you look at the image over here, this is our lingual nerve and this is our duct over here. So we can see that at first the nerve lies above the duct and then it crosses its lateral side and loops around it, and then it ascends medially, winding around the lower border of the duct. This is the relation of lingual nerve with submandibular duct. Next, let's talk about the different supply of the submandibular gland. So, the arterial supply is by the sublingual and submental arteries, and venous drainage is the veins correspond to the arteries and they drain into the internal jugular vein. Lymphatic drainage is into the submandibular lymph nodes, which further go into the jugular-digastric lymph nodes. Next, coming to nerve supply. Now, nerve supply can be divided into three parts: parasympathetic, sympathetic, and sensory fibers. Now, parasympathetic and sympathetic, they are both responsible for giving secretomotor supply. So, when the parasympathetic fibers are stimulated, it gives a very watery secretion, and when the sympathetic fibers are stimulated, it gives a mucus-rich, sticky secretion. And very important to remember here is the sympathetic fibers is not just secretomotor supply, but also vasomotor supply as well. Now let's look at the pathway of the supply over here. First, we'll talk about parasympathetic fibers. So, in parasympathetic fibers, the preganglionic fibers come from the superior salivatory nucleus of pons. We remember we were talking about the parotid gland nerve supply, the preganglionic fibers originated from the inferior salivatory nucleus of medulla. So once the preganglionic fibers have now originated here, then it passes through the facial nerve, choroid tympani nerve, and the lingual nerve, and then it relays in the submandibular ganglion. After relaying in the submandibular ganglion, the postganglionic fibers, they directly supply the gland. This is again an important question here to remember that the postganglionic supply is directly happening and not via another nerve. Next is the sympathetic fibers. These originate from the sympathetic plexus around the facial artery. This is created by the postganglionic fibers coming from the superior cervical ganglion. Lastly, the sensory fibers are by the lingual nerve. So that's about the nerve supply of submandibular gland. Now let's discuss a few applied anatomy questions that could be related to this, and some. It's very important for you to know why are you learning all these anatomical features of the gland. So they must have some important clinically or surgically. So let's discuss them one by one. So it has been seen that calculi formation is more common in the submandibular duct compared to that of the parotid duct. And this is because of two particular reasons. First of all is because their secretions are more viscid. And second, we have just seen that the submandibular duct has a very upward course. So this hampers a simple drainage into the floor of the mouth because this is against gravity. These are the two reasons why we see that calculi formation is more common in the submandibular duct. Next, how will we differentiate a swelling of the submandibular gland from a swelling of the submandibular lymph node? The answer is very simple. We will do a bimanual palpation. So whenever there is a swelling of submandibular gland, these can be bimanually palpated by placing an index finger in the mouth and thumb below the angle of the jaw. Why can we palpate it bimanually? Because there is a part of the gland which is located in the oral cavity above the floor of the mouth, and part of it which is below the floor of the mouth. Because of this, because of the way that it is present in the floor of the mouth, we are able to bimanually palpate it. Whereas if there is a submandibular lymph node swelling, in that case, this will not be felt bimanually because submandibular lymph nodes are only located below the floor of the mouth. So, this is a very important clinical question that you need to know whenever a patient of submandibular swelling coming to you. How will you differentiate between a node swelling and the gland swelling? Next is, so if a stone does form in the submandibular duct, this can also be felt manually inside the mouth. And once you have felt that manually, you can also remove it from the inside of the mouth by incising the mucous membrane and the duct over the stone. Last of all, when you are performing a submandibular gland excision for any reason, maybe there is a tumor. At that time, when the skin incision is given, it is important to remember this feature over here. You'll give the skin incision below the angle of the mandible. And we'll talk about how much below and why. So, the marginal mandibular branch of the facial nerve, it enters 1 inch posterior inferior to the angle of the mandible before crossing its lower border. Therefore, so as to not injure this nerve, we will give the incision about 4 centimeter below the angle of the mandible. So these are all the clinical significant anatomy that you need to know here, and that completes our discussion on submandibular gland. Next, we are going to talk in short about sublingual gland anatomy. So the sublingual gland is the smallest gland amongst the three major salivary glands. You can see in the image over here, this is the location of the sublingual gland. It is almond shaped, is very small, weighs about 3 to 4 grams, and it has mucus type of acini. So now we know that the sublingual gland is mucus type, the submandibular gland is a mixed type, and parotid is a serous type. Coming to the location of salivary gland, it lies in the floor of the mouth between the mucous membrane and the mylohyoid muscle, and it lodges in the sublingual fossa of the mandible. Next, let's talk about what are the relations of this gland. So, anteriorly, it meets with the sublingual gland of the opposite side behind the symphysis menti. Posteriorly, it comes in contact with the deep part of the gland. You can see over here, this is the deep part of the gland that it comes in, deep part of the submandibular gland that it comes in contact with. Superiorly, it is covered with mucous membrane of the mouth, and it forms the sublingual fold. Inferiorly is the mylohyoid muscle. You can see in the image, this here is the inferior relationship. Laterally is the sublingual fossa of the mandible above the anterior end of the mylohyoid line. And medially, it rests on the genioglossus muscle separated by the submandibular duct and lingual nerve. So these are the relations of the sublingual gland. Now let's talk about the ducts of sublingual gland. Now this gland has about 8 to 20 ducts, and out of which majority of the ducts, which is known as ducts of Rivenus, they open separately in the floor of the mouth on the sublingual fold. Whereas there are very few ducts from the anterior part of the sublingual gland which unite to form the sublingual duct, also known as the duct of Bartholin, and this opens into the submandibular duct. So, this is how the ducts open into the oral cavity ultimately. Coming to its supply, the blood supply is sublingual and submental arteries. Lymphatic drainage is the same, submental and submandibular nodes, same as that of submandibular gland. Even the nerve supply is same as that of submandibular gland, but there's a small difference over here. So the nerve supply again has parasympathetic, sympathetic, and sensory fibers, and both parasympathetic and sympathetic is responsible for secretomotor supply. If the parasympathetic fibers are stimulated, there is a watery secretion, and if the sympathetic fibers are stimulated, there is a mucus-rich sticky secretion. And here also the sympathetic fibers are not only secretomotor but also vasomotor. Now, coming to the main difference, that which is the pathway of the parasympathetic fibers. So, most of the pathway is the same. So, the preganglionic fibers from superior salivatory nucleus of pons, then to the facial nerve, the chorda tympani nerve, the lingual nerve, relaying in the submandibular ganglion. And this is where it changes. What is the change? We saw in submandibular gland that the postganglionic fibers directly supply the gland. Here the difference is the postganglionic fibers go via the lingual nerve and then supplies the sublingual gland. So that is a major difference to remember. Other than that, the sympathetic fiber and sensory fiber supply is the same as that of submandibular gland. Last of all, coming to applied anatomy, we know there's a swelling called ranula. Ranula is this swelling which the name comes from frog's belly because it looks like a frog's belly. It is this bluish mucus retention cyst that happens in the floor of the mouth, and the cause of this is the obstruction of the ducts of the sublingual gland. So that's all about submandibular and sublingual gland anatomy. If you have any further questions, please note them down in the comment section and I'll get back to you. Thank you.